how to get to your doctor if you don't drive anymore. Let's be real. Getting to the doctor isn't always easy, and if you don't drive anymore, it can feel downright frustrating. You might feel stuck, isolated, or like you have to depend on others to just get to a routine appointment. Maybe you've had to cancel because no one was available, or you've delayed care because the logistics just felt too hard. But here's the good news. You're not out of options. Whether you gave up driving recently or years ago, there are ways to stay on top of your health and still get where you need to go, safely, affordably, and with less stress. Let's walk through what you can do. Number 1, start with your care team. First, tell your doctor or care coordinator that transportation is a challenge for you. Why? Because in many Medicare programs, like the APCM model, your care team is literally there to help remove these kinds of barriers. They may know of transportation services covered under your plan or local programs that you qualify for. And if they don't know right away, they can help find out. Never assume your doctor's office can't help. It's more connected than you think. Number 2, check if your Medicare plan includes ride benefits. If you're in a Medicare Advantage plan, it may include transportation to and from medical appointments. That could mean scheduled van rides, rideshare services like Uber or Lyft, or even mileage reimbursement if a friend or neighbor takes you. Call the number on the back of your Medicare card or talk to your care team to find out what's available in your specific plan. Number 3, look into community transportation programs. Many local nonprofits, senior centers, and houses of worship offer volunteer driver programs or shuttle services for older adults. You may be able to schedule a ride for free or at a low cost, and often with people who understand your needs and want to help. Start by calling your local agency on aging 211 or community senior center. Just tell them, "I'm looking for transportation to medical appointments." They'll guide you from there. Number 4, get creative with your circle of support. If you have family, friends, or neighbors who are already helping you in small ways, don't be afraid to ask about regular rides, especially if you can schedule them in advance. Some folks create a rotating schedule. Maybe a friend drives you to your primary doctor, your daughter takes you to specialists, and a neighbor helps in a pinch. You can even offer to treat them to coffee or lunch as a thank you. It makes the trip more fun and reminds you both it's a shared experience, not a burden. Number 5, use rideshare apps with help if needed. Apps like Uber and Lyft can be great tools for seniors, but only if you're comfortable using a smartphone. If tech isn't your thing, you're not out of luck. Some services allow you to book rides over the phone or through a caregiver. And some Medicare programs even partner directly with rideshare companies for medical rides, so you don't have to handle payment or booking yourself. Ask your care team if you qualify for those kinds of services. They can help set it up. Number 6, if your mobility is limited, ask about door-to-door options. If you use a cane, walker, wheelchair, or just need a little extra help, look for Paratransit or non-emergency medical transportation services. These usually include trained drivers, help getting in and out of vehicles, and vehicles equipped for mobility devices. In many places, these services are required by law and available to people with disabilities or health limitations. You may need to fill out a short form or get a note from your doctor, but once you're approved, it can be a game changer. Number 7, schedule smart. Once you have a transportation option, try to schedule your appointments in a way that makes the most of your time. Bundle multiple errands into one trip, like going to the doctor, then picking up a prescription, or stopping at the grocery store. Some programs will allow a short stop along the way, so it's worth asking. It's all about working with your reality, not against it. Number 8, don't skip care just because it's hard to get there. This one's important. Delaying care because of transportation challenges can lead to bigger health problems down the line. If you can't find a way to get to your appointment, say something. Your provider may be able to switch to a telehealth visit, send a visiting nurse, or reschedule you for a more convenient time. You're not an inconvenience, you're a priority. Just because you don't drive anymore doesn't mean you've lost your independence. It just means you need to approach things a little differently. With the right tools, the right support, and a care team that listens, you can stay in charge of your health, keep your appointments, and live life on your terms. So the next time you think, I don't know how I'll get there, remember, you've got options, and you've got people in your corner to help you find the right path.